And okay. All right. New. That presentation. And then, yep, no problem. Yep, and then, yeah, exactly. Just gonna make sure that all these people.
Thank you. So how's everybody? Good? So you know why we are here today? So we are about to discuss about the knee joint. And I'm sure you might be aware of like why you people are here. Because you want to take the charge of your own health and you want to know how you can prevent the injuries and how what are the reasons behind those injuries. So there is a strong relationship between form and function. So it's very important to know the anatomy and physiology of a joint, to know exactly what is the mechanism behind all these injuries and how you can prevent them. All right. So let me start first with the anatomy of the knee joint. As any other joint in the body, it's composed of bones, ligaments, muscles, cartilage, tendons, and bursae. It looks like a lot of technical terms, but like bones are like, as you must be aware of, so I'm going to show you some diagrams along with the how the joint is actually composed of. So there are three bones in the knee joint. It's the femur, the tibia, and the fibula. You can actually palpate them in your body if you can see. There is a big bone known as femur. It's this bone, and then the tibia in the lower leg, and then the fibula. It's a small bone on the lateral side of the leg. And there is a very small bone on top of them that we call kneecap. You can actually feel the kneecap if you extend your knee joint, and you can move your kneecap actually from medial to lateral. Can you feel it? And you can only feel it when the knee joint is straight, because when you bend it, it's so tight that it's so hard to move that bone over the underlying bone. So these are the main bones in the knee joint, and as you all know that the movements in the joint are produced by the muscles. So knee joint is one of the largest joint in the body, and it's very complicated because there are so many muscles that are controlling the knee joint, and there are so many ligaments that helps to stabilize the knee joint. Because like we put too much on our knee joints. We walk on it, we go up and down the stairs, we jump, and it's like 3 to 4 times of our body weight that we are putting a lot on our knee joints. So that's why it's very important to know how this joint works. And it's so much prone to the injuries, especially in the females. Wearing heels is something that we like to do. So it puts knee joint too much prone to like so many injuries. So these are the structures that form the knee joint. That is bones, muscles, ligaments that helps to stabilize the joint, cartilage, and then tendons, and then bursae. Tendons are basically the structures that where the muscles attach to the bone. That point is called tendon. And the ligaments attach bone with the bone. So ligaments actually attach bone with the bone, and tendons attach muscles with the bone. So this is the front view of the knee. We always hear about that these are the quads, these are the hams and quads. Quads is basically a very major muscle of the knee. It's quadriceps muscle, which helps to extend the knee, straighten out the knee. That's why some of you might have experienced the buckling of the knee while you go up and down the stairs. This is the major muscle that controls the major movement of the knee. That is the extension of the knee. Like when we go upstairs. So it's so complicated that different motions of the knee are required for different actions of the knee. Like if you're going, these muscles control the knee at various angles. So it's very important for these muscles to work. All right. So this is, as you can see, this is a quadriceps tendon. Quadriceps is a big muscle in the front of the knee that controls the knee extension. And the same tendon goes down as a patellar tendon. There is a patella bone, as you just felt, in the front of your knee joint, and you can also move it. It's again very crucial for the knee. It's very crucial for the knee function. It's a small bone. And then tibia and fibula, you can see these muscles, how it's coming from the thigh, and it's attaching to the lower leg. So that's why, as you can see, this is a long muscle and it's coming from the thigh. It's so important for the proximal joints to work in a right way to help the distal joints to work properly. So basically, if you have a pain in the knee, it's pretty much, the reason could be anything. It could be also coming up from your hip. So it's very important for the entire lower extremity to work in a right way. Let's move on to the next slide. So at first we discussed about the quadriceps muscles that is on the front of the knee. It composed of 3 sections: vastus femoris, vastus intermedialis, and vastus lateralis, and vastus medialis. These are like very technical terms. You need not to know that. All you need to know is how the knee works and how you can prevent the injuries to happen. All right. And this is another muscle, that is biceps. You can see there are 3 parts of the biceps: semimembranosus, semitendinosus, biceps femoris. Again, too complicated terms for you, but you can feel it on the back of your thigh. These are the huge muscle groups, and you can also feel the tendons of the biceps if you can flex and extend your knee. Can you feel that? Just on the back of your knee, the 2 prominent strings. Flex and extend. You can feel the tendons of these muscles. So these are hams. So hamstrings and quadriceps, these are the basic muscles of the knee that we want, that you might have heard a lot about the athletes. They have a hamstrings. A lot of injuries involve the hamstring muscle. So it's a very important group of muscle. Hamstring, that has 3 components: biceps femoris, the other 2. All right. So biceps femoris basically controls, as you can see, it's going on the outer side of the knee. So it controls the outward rotation of the knee. And the other 2 group of muscles, they control the inward rotation of the knee. Knee is basically a hinge joint. So there are 2 major movements, that is bending and extension. That's all we know. But then, in addition to that, we also have some degree of rotation in our knee. And that rotation we can feel when the knee is bent, because the ligaments around the knee are a little bit loosened up. So you can feel that there is a little bit of rotation in our knee also. So there are, in addition to those 2 movements, there is another movement, that is rotation of the knee. All right. Now moving on to the next part, that is the physiology of the knee. I think you are not able to see that diagram. Is it better now? So that's the knee joint. It's again very complicated joint. There are so many ligaments, there are so many bursas, there are so many tendons in the knee that control that. What are bursas? Bursas are fluid-filled sacs actually. They help to cushion up the knee joint. Like there are meniscus. There are 2 menisci in the knee joint. In the medial one and the lateral one. Because if you'll see, let me take you back. Like, if you'll see that this is a femur, there are 2 compartments, medial and the lateral. So these joints have 2 compartments, medial and the lateral. So the bones doesn't move on bones just like that. There are cushions inside. There are meniscus inside. There are bursae. These are all fluid-filled sacs which help to smoothen up the motion, which lubricates the joint basically. So injury to any of these structures, ligaments, tendons, muscles, or bursa, it can lead to pain in the knee. So it's so important to know what exactly is the root cause of the problem to treat that problem. So that's why it's so important to know what's the mechanism inside, like how these ligaments and how these muscles actually work and how they lead to their injuries and how you can prevent them. So again, coming back to the motion of the knee joint. Motion, again, as I discussed, you can see that it moves in two ways, flexion and extension. So this is the bending of the knee and this is extension of the knee. But in addition to that, when the knee is like around 90-degree flexed, you can feel a little bit of rotation inside the knee joint too. Alright? And as I already discussed, the flexion of the knee is controlled by which muscle groups? Let me check. You are hearing? No, quadriceps are in front. So quadriceps control the extension, the straightening of the knee. And hamstrings are on the back. So they control flexion of the knee. So the knee bending is controlled by hamstrings and extension is controlled by quadriceps. Alright? So again, extension by? Exactly. And flexion by? Hamstring. You must be hearing a lot about hamstrings. I'm sure you must have heard about this muscle, right? Have you ever thought about like what it comes from? What does that actually mean? Hamstrings? This basically term, it originated from the butchers actually. They used to hang the hams, the tendons of these hams for smoking. It's interesting to know, like that's how it came to be known as hamstring. So it's funny because these tendons are so strong, you know, you can feel that in the back of the knee, and injury to any of this can lead to serious functional disability in anybody. All right. So degrees of motion, as we discussed, again flexion, which is controlled by the hamstring, it's around, in a normal people, it's around 120 to 150 degree. And extension, it's, as you can see, it's straight, it's 0 degree. And then coming to tibial rotation, as I told you that there is a mild degree of rotation in the knee. It's the internal and the external rotation. And then again, a very technical term, that is screw home mechanism. Hi, sorry, no problem. So the screw home mechanism, what exactly it is? It's basically, it's related to the structure of the knee joint. The knee joint, as I told you, it's composed of two, like the main bones, the femur and the tibia and fibula down in the lower leg. So there are two condyles of the femur. You can actually feel it, the medial and the lateral, two big condyles. That's a part of the femur. And if you go a little bit down, you can feel the bony prominences of the lower leg bones, tibia and the fibula. So basically what this screw home mechanism is, it's the final phase of the extension, final phase of the knee straightening. What happens is the knee joint, it moves more on the medial side rather than on the lateral side, because the medial bony prominence is larger than the lateral one. Again, let's make it very simple. It's just an external rotation. It's just a final phase of the extension where the femur rotates on the tibia. Alright? And that's what's called screw home mechanism. Again, coming back to the same thing, we are like mainly discussing about the muscles and the joint and the ligaments, the primary flexors, the primary extensors and the rotators. The primary flexors, you know about that. That is exactly. And the primary extensors, perfect. And the rotators, as I told you, that is a part of the hamstrings. Rotator, the tibial rotation or the knee rotation comes from the big muscle on the back of the knee. That's hamstrings. One part of the hamstring, that is biceps femoris, it controls the external rotation, and the other two parts, that is rectus, that is semimembranosus and semitendinosus, they control the internal rotation. So these are how these rotatory movements are controlled. So pretty much this is all you need to know, is that there are two major muscle groups that control a major part of the knee function: hamstrings and quadriceps. All right. Let's go to the. I basically briefed you, told you about the normal angles of flexion and extension and what are the muscle groups related to that. Again, it's bending, which you can bend your knee like it's from 120 to 150 degrees. Anything lower than that means that there is a restriction in something. Again, a restriction could be anywhere, because knee is a complicated joint. Any restriction in the function, in the range of motion, it can be a result of a muscle injury, it can be a ligament, it can be a tendon, it can be a bony involvement. So again, it depends entirely upon where exactly it's coming from. All right? So there are different types of knee injury and dysfunction. As I told you, in the beginning, we discussed about like what the knee joint is basically composed of. It's composed of the bones. So any injury that could lead to the fracture of the bone, that will impair the function of the knee joint. Like if there is a direct impact, direct blow on any of the bone, if any of the bone there is any fracture, it will be difficult for you to walk, to bear weight on the knee joint. And the other injury will be muscle strain or ligament sprain. So there are two terms that we also come across on the daily basis. That is the strain and the sprain. So what exactly is a sprain, and what exactly is a sprain? Have you any idea about anybody, like what's the strain? What's the difference between strain and the sprain?
Is a strain when you overuse something, and a sprain is when you actually damage it?
Actually, the strain and the sprain, the main difference between them is strain basically involves the tendons or the muscles. It's any tear or any overuse or anything, any tear of the muscle or a tendon is a strain. You must be commonly hearing about the hamstring strain. Again, I'm using this term again and again, hamstring strain, because you can feel the tendons on the back of your knee. You can see that how like they're so much prone to the injuries. So the most common example of the strain would be like the hamstring strain. And sprain is basically a torn ligament. And as I explained you earlier, what is the difference between what are tendons and what are the ligaments? Again, let me just revise it. Tendons are which connect the muscles to the bones, and ligaments connect bones to the bones. So any tear in the muscle or tendon is a strain, and sprain will be any tear in a ligament. And you must be hearing about what's the most common site for the sprain? Ankle. It's all the time, wearing high heels or anything, it leads twisting of the ankle, it leads to ankle sprain. So these are like the most common injuries in the knee. Sprains, strains, and then tendon injuries, as I already explained you, it could be any tendon, like as I just gave you the example of the hams, it's the tendon injury, and hamstring strain. It's most frequently, it can also occur in your back when you're lifting very heavy things. You always say that I have a strain in my back. So the strain is basically a tear of a muscle and or a tendon. And coming to the cartilage injuries, as I told you, the joint surface is covered by a cartilage. And you must be hearing this term also very frequently, the cartilage. So what exactly it is? And how does it affect your knee? With the aging process, there are so many degenerative changes, and there is a degeneration of the cartilage too. That gives you that leads to the wear and tear of the joint surfaces. That's why most of the people, especially in their old ages, they feel the pain and the aching in their knee joints. That's the main major degenerative process of the cartilage. That's most common. And now coming to the mechanism of the injury, you all know, and many of you must be having a lot of knee injuries, or I'm sure you must have come across the people who have had the knee injuries. So what's the mechanism? The most important thing is it, how much force and how's the impact. Like what activity you are doing. It could be anything. Mechanism could be anything. It could be a strong blow on your knee. It could be a twisting of the knee. It could be a rotation of the knee, and it can impair any of the structures because there are so many things as you have already seen. There are so many tendons, ligaments. So it could be any rotatory force, direct blow, or anything that can impair your joint integrity. Like it can affect the ligaments, it can affect the tendons, and so anything, whatever is the mechanism of the injury, any direct blow or any when you are playing high impact sports, or any twisting or any rotation, it's gonna anything that's gonna affect your ligaments, muscles, joints. It's gonna affect secondary to the joint motion. So anything, whatever will be the injury, it will first affect your joint motion and the joint stability. Like that you always feel. The most common complaint is I cannot bend my knee, I cannot tie my shoelaces, I cannot go upstairs, I cannot go downstairs. So it's gonna affect, that's basically the joint mobility and the stability. Any injury, whatever structure is being affected, it will affect the stability of the knee joint. And if the stability of the knee joint will be affected, it will later on affect the function of the knee joint, like the movement of the knee joint. So that's pretty much it. And now coming to what are the risk factors for the knee dysfunction. And after that, Mike will take over and will explain you how to prevent those injuries and what are the surgical approaches to treat those injuries. So I'll be basically discussing about what exactly is a knee joint, and what are the structures that are prone to the injuries, and how you can basically, what are the risk factors for the injuries. So there are, as I told you, again I'm coming and emphasizing on the same point that basically what's the root of the problem. It could be only what the joint is composed of. It could be bone, it can be ligament, it can be tendon, or it can be cartilage or a bursa, anything. So all these things, like first let me first describe like what is a Q angle. It's again a very technical term. Let me try to explain you it in a simple way. Q angle is basically angle between the upper leg and the lower leg. Like if you feel there are bony prominences on of the hip bone, like the direct line coming to the center of the knee joint and the lower leg, the angle between these two lines is called Q angle. And it's different in males and females because females have a wider pelvis than males. That's why there is a difference between structural, there is a minor difference between anatomical structure of males and the females. So that's why they are prone to some injuries. Alright? Then genu varum and genu valgum, it's again, it's basically a relationship of the upper leg and the lower leg. As I told you, the Q angle is the angle between the upper leg and the lower leg. It's a straight line coming from up, and then as you can see, your lower leg is never straight. There is an angle between your upper leg and the lower leg. That angle is called Q angle. And the genu varum is the term, it basically describes the bowing of the legs. It's you must have seen, it's basically a pathologic condition. If the angle is too much, it can lead to bowing of the legs. It's called genu varum. It's basically internal rotation of the lower leg. And coming to the valgum, it's basically external rotation of the lower leg. So knock knees is a common condition. You must have seen that. When the knees come closer, that's called knock knees, and that's genu valgum. So it's genu varum is basically internal rotation of the lower leg, that is tibia, and genu valgum is external rotation of the lower leg, that is again the external rotation of the tibia. Alright, then comes to the genu recurvatum. It's basically hyperextension of the leg. We discussed about screw move mechanism. I know these are all very technical terms for you, but this is the final phase of the extension, as I told you. You must have seen a lot of people like walking with the hands on their knees. Basically, when they have a lot of buckling, it's basically a knee hyperextension. When you move when your knee joint is moved back, so that's called genu recurvatum. And as we discussed about patellar alignment, it's so important for the knee joint. It's a small bone in front of the kneecap. As I told you, that you can also feel it moving from side to side when your knee is straight. So the alignment of that bone is also very important. It's controlled by a lot of muscles. You must have heard about the chondromalacia patellae. I'm not sure. It's basically a condition where patellar alignment is disturbed. And then coming to the ligamentous laxity, again ligaments, they help to maintain the stability of the joint. Any laxity or any dysfunction of the ligament, it's going to impact the stability of the joint. I don't want to make it too boring actually. These are too technical terms. So let me know if you have any questions. I just want to cover the basic things, like what exactly are, I don't want to give you too much information because it can be very confusing. All I want to explain is basic anatomy of the joint, like what are actually the bones, muscles, ligaments, how they actually work. And coming to the social factors that can lead to different injuries. Age, definitely, it's a very big factor. As you grow old, there are a lot of changes in the bone. Muscles become weak, ligaments become lax, and there are a lot of instability issues. And it depends upon, as I told you, males and females, they have different structural anatomy. So, and especially with the females wearing heels and high heels, they put too much forces on the knee. So it depends upon what's your lifestyle, like there are a lot of factors that leads to different injuries. So next, coming to the occupation, what kind of work you have been doing. If you are doing a lot of heavy lifting, how much you are using that joint, how much force you have been putting throughout your life. It's so important. And environmental factors, and again, what's your lifestyle, it's whether it's active. It's so different between the normal people and from an athlete who has been playing throughout his life, and it's really different because everybody is putting a different amount of stress, different amount of force on their knee joint, and that's how it determines like who is prone to what kind of injury. And then recreational activities, again, as I told you, what kind of activities, your lifestyle, it depends a lot. It determines a lot how your knee's gonna work, like what kind of injuries you are most prone to. Like athletes, they will be most prone to the meniscus injury, a lot of rotation. Normal people don't normally rotate their knee a lot, but it depends entirely on whether the dancers, they're putting a different amount of stress on the knee joint. So these are all very important factors basically to determine what kind of injury you're prone to and how you can avoid that. And Mike's gonna take over now and he'll explain you how you can prevent the dysfunction and how you can treat that dysfunction. That is actually a more interesting part here.
Everything's interesting.
I must have bored you for it.
Well,
Thank you.
Thank
Thank
you.
you.
but you guys didn't know there was that much information on the knee joint, right? Yeah. So there's a lot of information about it, but basic idea behind it is that it's a very simple joint. You're bending, flexing your knee, and there are a lot of injuries associated with such a very quote unquote simple joint. But we're going to go over some of those dysfunctions and how to prevent them. I always ask, how many people here, I don't know if PJ already asked, how many people have had knee injuries in the past or are currently suffering with some type of knee injury? Okay. Can you tell me?
Well, it's my wife. She had pain in her knee, and she had to have surgery. Now they cut the cartilage from the knee, and now her other knee is bothering her.
Okay, so
And also, I wanted to know, when you have pain in the knee, right, is cortisone, what is the effect on cortisone on the knee?
we're going to get to that, definitely. One of the something affecting the cartilage of the knee.
I
You
had
guys?
the total knee replacement
You have a total knee replacement. You've had it done.
in September.
Okay, so.
And as you
surgical
said, the
intervention.
other leg and knee is hurting.
Starting on that. Okay. Yes, ma'am?
One day, about 3 months ago, I moved my leg a certain way and I felt the sharp pain over here. And
So it's the unknown injury then. Okay. And you guys?
I had when I was a kid, I would fall a lot, and I was told I had a trick knee. I was very knock-kneed. And later in life, I started jogging, and I somehow tore the meniscus in my knee, and they did a bilateral meniscectomy on me and told me I was good to go. In 8 days, I could start running again, but I couldn't really. And then it turns out that the knee that had the surgery now has bone-on-bone arthritis, and the other leg and the hip has been giving me problems because that leg is shorter, so the other leg takes a lot of stress. So now both of my knees are shot and one of my hips goes out. So,
Okay, so.
not a plug for treatment for, surgery anyway.
Right. So there's quite a bit, a few factors going on. Anyone else that wants to share?
Yeah,
Yeah.
as a, I think, yoga and Pilates teacher, one of the things that I find will happen sometimes with my right more than my left is sometimes it feels like it's sinking backwards. It's like I'll take a step and it goes back.
Locks back.
Yeah, it locks back.
Okay.
And it's, so there's that discomfort. I've had that on the past years.
Okay, maybe something involving the patella, the kneecap.
I stand all the time and I'm really tight. I know that, but what happened to me is that I was having increased difficulty with steps, with pain in my knee, and then I knew I was having that pain, and then I went to take a step, and something just burst, and then pain went down both sides of my leg, and I'm in the process of trying to figure out. I have an appointment here in a week.
Okay.
I already went to so I'm going kind of backwards.
In a way, I guess.
Oh, I want to have a good wealth of information.
Yeah, good. To take the class first before knowing what you're getting yourself into and what you
So,
can do.
but I know that I have grinding in the knee.
Yeah, very typical. Preface, and that's typical of maybe some type of arthritis going on there. Well, let me ask you now, of all the injuries that you've had, do you think that maybe some of them, if not all of them, could have been prevented, or people that have injuries could prevent those type of injuries, or getting to that point where you really need surgical intervention? Yes, you can. Because as PJ was telling us, giving you some information before, there's some things that we can't change. Our gender, the way that we were formed, our different preconditions, our genetics are something that we can't do anything about. So we're formed a certain way, and certain people are more disposed to certain injuries, and certain people are less disposed to certain other injuries, and that goes with almost every part of the body. But even with those preconditions, we can take steps to prevent any type of injury involving the knee or any type of joint, as long as we're informed about it. So being informed is worth 1,000 cures. Prevention is worth 1,000 cures, like the old saying goes. And even people that have an injury can also prevent it from getting worse, if not getting better. So let's go over a few things to prevent knee dysfunction and any type of knee condition. So for one thing, I always like to stress this part, proper posture. People don't realize how important posture plays into our everyday life, whether it be our knees, our ankles, our shoulders, our neck, our backs. Making sure that we are in proper posture, whether we're sitting or standing or walking, because that's basically what we're doing, and we're throughout the course of our day, we're putting stress through those particular joints. So if you're in that posture or in a poor posture for a very long period of time, you're going to be putting stresses on those joints, causing reactions and causing eventually an injury to you. So proper posture is really important. I will go over that in the next slide. I hope they added it to it. Yeah. Okay, good. We'll go over that on the next slide. Avoid aggravating activities. I'll also go over that in the next slide. Use of a brace is also, pretty important if you have an injury. A lot of times you'll see people with those knee braces with a cutout for the kneecap. And a lot of times I suggest that to people if they start feeling some type of problem. It's a problem that can be corrected. I'll tell people if you have an injury like that, it's good to brace and to allow the knee to heal itself. So using a proper brace is a good step, good first step in the acute phase if you start having some type of pain or some type of condition involved in the knee. Now, I'll explain to you why it's good in the very early stage, but it's very bad to continue using a brace over a long period of time. Great things are home exercises. Being active is one of the best ways between posture and being physically active. Best ways we can do it to prevent any type of injury, including the knee. We've been made to function and to move around and to be active. So if we don't do that, if we're sedentary, which most people are, if you really think about a typical person's day, they spend about 8 to 10 hours typically, sitting down at their desk. About a half hour to an hour sitting to get to work. When they get home, another half hour, an hour to get home. Then they're sitting down for a meal, another hour, half an hour. What happens usually after somebody eats a meal? Or they go to bed, or they sit in front of the TV for another hour, 2 hours, and typically they say that the average American watches about 3 or 4 hours of TV at night. It's a lot. So that whole time you're sedentary, you're sitting down. People aren't getting the exercise they need, aren't getting the other benefits of being in an active lifestyle. So this is one of the key things to really prevent injury, is being active, knowing what kind of exercises to do, what kind of stretches to do. The knee can get very tight, especially when you're sitting down, when you're immobile. The muscles around that area will tighten up and will cause additional pressure on that joint. And why is that important? Why is it important to know that? Well, like PJ was saying, is that that joint the knee joint is a very, it's a hinge joint, and they're very close together, the two bones. So the tibia and the femur, which I had a model for you, but we'll get that next time. So if that joint, there's a certain amount of space between that joint, you have cartilage and you have other structures in between, ligaments. If you're not moving for a very long period of time, the muscles around that joint will almost cause it to become like a vice. So you're causing that knee joint to get closer and closer and closer together. And so when you start actually doing some type of movement, that 5-10 minutes of the day that we're actually up and moving and walking around, now you don't have any movement there. Everything is very tight, stiffens up. So all it takes is a twist or a turn or a step up, a long step, or even a trip up, that normally we'd have enough movement. We typically wouldn't, if we are in that condition, we'll end up causing an injury to ourselves. So we'll end up wearing away of the joint, or tearing of a ligament, or cartilage, or end up with a fracture or something even worse than that. So building up the muscles so that they have the strength to hold our joints in place, so that we're not putting pressure on the joint, but also that they're flexible, so that they're able to move around. They're allowing the joint to have that freedom of movement, so that we are moving, that we don't have any of those type of injuries. So that's very important. And a lot of people, they don't realize what kind of exercise, what type of stretching to do. So that's why they go to professionals. They find out there's a multitude of information out there on what type of exercise, what type of stretches to do to really keep yourself in good shape. And that's one key thing that I always also stress with people. So if you have any type of questions about that, about what kind of exercise, what type of stretches, you can talk to a professional, like a physical therapist. There's a lot of information online. Be an active person, if you can. If you don't have an injury, even if you do, knowing which type of exercises and stretches to do so that you don't make the condition worse or you prevent the condition in the future. I always mention a little bit, even though we're not nutritionists, and I'm not a nutritionist by any means, I always tell people the importance of vitamins, good health, eating a correct or a good meal, keeping yourself in good shape on the inside also. A big thing that I've been hearing from a lot of doctors is the lack of vitamin D in a lot of people's diets, especially. They say most people are deficient in vitamin D, and a lot of it's because of the sun, that we get our vitamin D by the sun. So many people are worried about getting that type of exposure, which is understandable. But because because of that, there's also a very low amount of vitamin D in our body. So the doctors do recommend, intake of vitamin D, about 1,000 to 1,500 international units of vitamin D3. And also in conjunction with people that may have bone density loss or have reached, for women, a certain age where they may end up having bone loss. Also, calcium is a very important thing. Vitamin C is also very good. Magnesium. So speak to your doctors about that if it's not going against any type of medication that you are taking, and see what you're lacking, what vitamins you can take, because that does have play a part in what type of dysfunction or prevention of dysfunctions and injuries, not just at the knee, but the entire body. So keep yourself in good shape on the outside, exercising, being fit, and also on the inside on what you're eating. And another key important thing is hydrating yourself. About 6 to 8 glasses of water if you can every day. That's one of the other important factors. It keeps your joints hydrated. It keeps them loose and lubricated so they are able to move in a proper manner. So that's another key thing to keep in mind. If we haven't been doing that, it's important that we do. So talking about posture and related incidents with activities that we may do. So keeping a proper posture when we're performing day-to-day activities. Who here, daily has to pick things off the floor or paper, whether it be a pen, whether it be, notebook or groceries. Almost everybody has to eventually, during the day, do some type of lifting off the floor. Now, what's the proper way to lift something off the floor? I mean, this picture shows ideally what we can be doing before lifting something off the floor. And the key thing is really to prevent any type of injury, because this is actually a mechanism of injury that can cause a lot of problems, not just now, but even in the future with your knee. So if we're going to, let's say, for example, picking up a bar, pretend this is some type of box that we're carrying off the floor. So if we're going down and we get on our knees here and we pick up the block and we're standing on there and then we're going back up, all that pressure, you can imagine going through your knees, especially if this isn't just a pound or half a pound of weight. If this is maybe a good 20, 30 pounds, maybe 40 pounds that we're lifting, up off the floor, we're putting all that weight through our knee joints, and especially through this tiny, tiny little bone in our knee joint called the patella, the kneecap. So could you imagine about 40 pounds of weight on the kneecap that's about the size of a $50? It's a lot. It's a lot of pressure on that joint. So that in itself can actually cause a lot of problems with it. So what I always suggest to people is if you're going into a squat, keep things low and always bend at the hips. Sometimes I tell people even like to kick out and try to lift something. And if it's too heavy, ask for help. And if you're going to go into a squatted position, the idea, and this is for people even that do squats at the gym, whether it's lifting something off the floor, always keep your knees, or especially the kneecap, in front of your toes. So if you're going into a squat, keep your knees behind you, behind the toes. Keep your back straight, head up, bring the weight towards you, and then lift straight up. By doing that, you're not putting a lot of force through this small little bone called the patella. And you're lifting using your muscles of your legs, your quadricep muscles, that are one of the largest muscles in the body, and one of the muscles that are least used when people are doing a lot of lifting. A lot of people lift through their backs, put pressure through their knees. So that's why proper form, proper body mechanics, proper posture, when you're doing any type of lifting, just like this picture shows. Back straight, knees behind the toes, keeping the weight close to you, and then doing a lift will actually prevent a lot of injuries with the knees. Typically, one of the largest injuries, or a group of people that I've seen with knee injuries, can you guys do you have a guess what population, what type of workforce may end up having the worst knee pain or knee problems, knee conditions? They're one of them.
And changing
Teachers also, I guess. Yeah.
Those people that play carpet.
That's it. People that play carpet. I've seen so many people. And why do you think?
Horizontal knees.
Horizontal knees. People lay tile, put down carpet especially, because I guess a lot of them don't wear any type of protective knee pads, so they don't realize it, but they're putting a lot of weight, through their knees, and they're on there, 7-8 hours a day. But that just gives you an idea of why it's important to avoid those type of positions. Don't put a lot of pressure through your knee. If you're going to have to do that, if you need to put one of your knees down, just like this picture shows, make sure you have good padding underneath it. So put a couple of pillows if you really have to be on your knees, whether it's for prayer or for some type of other activity that you really need to be on your knees for a long period of time, especially. Get some type of padding, a couple of pillows, couple of pillow up, so that you're not putting that pressure through your knees, and you will prevent a lot of injuries involving the knee. Or if you have injuries, you won't make it worse. This last picture shows the perfect squat, in my opinion. If you can see that this person's form, he's not bringing his knees past his toes, back is straight, arms in front of him. So if we're doing, which is a great exercise to build up the muscles of your quadriceps, your leg muscles. So if you're doing that, you're always keeping that proper body balance. You're not putting stresses on top of that kneecap. Because one of the reasons why, if you start bringing this kneecap forward here, past the toes, you actually get another effect. You get this quadricep muscle that attaches below the knee, which is the patella tendon. If you go past your toes, you start causing this muscle to push against the kneecap. So you're almost flattening that kneecap as if you're pushing it down onto the floor. So think of it almost like a piece of plastic from here to here. As you're going down, that plastic is stretching, but it's also pushing back onto the knee. So that's why if anybody is doing squats or if they're doing any type of exercise, I try to advise them, always make sure you're doing it with the proper body mechanics, so your toes are straight, wide base of support, and then you're going back down, and just like this person is, it's almost as if he's going into a seated position, which he is. He's sitting on top of a block. So that's a great way to start practicing. It's a great exercise for people that even have knee pain. You're going back down almost as if you're sitting into a chair, and you're coming back up. So those are some ways to avoid and prevent injuries. Any questions about that?
Now you say that you have to keep your knees behind your toes?
Yep.
How is that possible?
Okay, so if I'm going down, if I'm going into a seated position, I'm going back down, I'm doing a squat, where are my knees? They're always behind my toes, or if not, they're right at parallel with my toes. Nothing forward like this.
Yeah, but if you're lifting something, your knees are going to go forward of your toes.
How are knees forward?
I don't know, in the picture there, it shows that the knees forward of the toes.
Let's go back.
See the young lady?
This one?
Yeah.
It's misleading the picture.
That's why I'm saying.
It's misleading, but here, I'll show you. Very easy. If you're doing that, you're going to lift something up, going to a seated position, lifting what I need to lift, toes, right behind them, back up, turning, putting the weight back down. Does that make sense? Or no, not really.
I don't know, you have to put it into practice.
Yeah, oh yeah,
That's
I
the
know,
whole thing,
practicing, of course.
And, I don't think what you're saying is really practical.
It's not practical?
No. It's not what people do.
That's right.
Yeah, that's
It's not what people do. This is the whole thing.
Many people on the knee injuries.
People don't do that.
I know. You're right, and many people don't know that. But you have to practice it.
Yeah.
That's the problem with a lot of people. Yeah, I mean, it's much easier to do, do this. Some people that do that, they put one knee down, and now look at how much weight. Let's say this is light. If I'm doing this with 80 pounds, I'm going to lift this up. Look how much weight is going on that small kneecap. You think that one small bone, it's the size of a $50 in diameter, is going to be able to sustain 80 pounds of force going through it?
Also, too, when you bend over, I've seen a lot of people bend over just from their back. They don't know it's squat at all.
Yeah, that's even worse. That's right on the back.
I know.
Yeah. Yeah. So pick your poison. You want bad knees or bad back. Usually it's worse when you're bending at the waist, and that's really putting a lot of pressure on your back. I mean, if you're going to choose one, I'd say squat a little bit more. But it takes practice, and see, a lot of people don't realize that, and people that are in the workforce, and they start doing that, and eventually over time they end up getting, maybe not today, maybe not tomorrow, but over the course of 10, 15, 20 years, doing it a certain way, doing it that way, because people aren't really that informed about it. So you start doing that, you start practicing that, and you end up with problems later on down the road. Knee replacements, arthritis, dysfunctions, ligament tears, meniscal tears, cartilage tears, all that fun stuff. So prevention, again, is the key thing. Making sure that you are flexible, you're using the proper body mechanics, and that's why I stress this so much with almost everything. You can prevent it. It's not an immediate fix, and that's why a lot of people say, well, the posture is not that great, not that important. But over time, you'll notice that if you keep that posture going and you're aware of it at least, it makes a difference. Definitely makes a difference. Even if you have an injury, just moving into those different postures, you'll feel a relief from it. But people that don't have an injury, you'll feel the effects maybe 20 years down the road if you're not in that posture. Okay, but that was a good question anyway. I mean, a lot of people are misinformed about those situations, so that's why it's good to know. Okay, so certain treatments for knee dysfunction. That's why I talked about proper posture. So if you have a dysfunction, just getting into that posture is really important.
Time is up.
So avoiding those activities, like we talked about, those squatting activities. Now, the use of a brace. So like I said, I like using that in the early stages of recovery because you take pressure off of the knee, you allow the knee to heal itself. But after a while, what can happen is that the knee muscles will actually start to atrophy. They'll get weaker because instead of using your leg muscles, you're relying on the knee brace itself. So you want to, as soon as that pain starts to calm down, get out of the use of this brace. Okay, and that goes for the knee brace. I've seen people with back braces, go on for months, if not years, using a back brace, and that just causes more weakness in those muscles. So this is just temporary, so that pain eases down. Using anti-inflammatories like Advil, Aleve, or any type of over-the-counter medication, the doctor may prescribe to you something a little bit stronger, like a higher dose of naproxen or any other type of anti-inflammatory. Modalities. I think one of the best modalities for any type of acute injury, an injury that had just taken place, is probably ice. I mean, it's very simple, sometimes even better than the medication. I tend to tell people right away after an injury, just as if you put your hand on a hot stove. Of course, you're going to put it underneath cold water or ice. Same thing with any type of injury of the knee. As soon as you get the injury, ice, 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 ice. So you can do it maybe 4, 5, 6 times a day to calm down that inflammation. And that, if you do that much, you can actually have a better effect than using the Advil or the Aleve, which I found doesn't work as well if you did use the ice. And I tell people about 15 minutes of ice, 10 to 15 minutes of ice. More than that, you actually may cause nerve damage, and you may have an opposite effect of it. So you don't want to do more than 15 minutes. Leave it off for about 15, 30 minutes. Reapply it. 15 minutes on, 15 minutes off. So that's the key thing. Doing that as soon as you have an injury is works wonders at bringing down the swelling, bringing down the inflammation and the pain. So obviously physical therapy, and if at the last resort, surgery is if it's necessary, it can be something that's done. There's some surgery, especially with the knee, that are necessary, especially athletes, people that want to get into an active lifestyle after an injury like an ACL tear. An ACL is one of the ligaments that PJ described inside the knee. If there's a full tear of the ACL, it's almost impossible for that ligament to reattach itself. It's just 2 parts of the fiber that split, and the body has no way of pulling those 2 fibers back together and reattaching them if it's a complete tear. So in those situations, you may need a to go in, and the doctor may have to go in and reattach, especially if you want to play sports, go skiing, retain a very active lifestyle. Some people have gone on even without the surgery, just building up strength in those muscles, and if they're not really pushing themselves to the limits, they've done well even without the surgery. But in those type of conditions, surgery, may be necessary. So the doctor will explain that to you. So the type of surgeries you have, a good majority of the surgeries now are done through laparoscopy. So you have instruments that make 3 little holes, sometimes 2, where they go in with the camera and the instrument, and they'll clean up if there's cartilage tear. They'll either repair the cartilage or they'll take out the part that's been torn. They have done ligament repairs that way. They have cleaned up any type of debris that sometimes ends up forming in the joint, any type of bone chips that sometimes can happen, causing people trouble or pain inside the knee. Joint replacements, which you know very well about, and I'll show a picture of a joint replacement. It's fascinating what they can do, and they usually last between 10 to 15 years. I think now they're pushing it even longer, maybe 20 years with the new technology and the new materials they're using for joint replacements. I know sometimes people like to know how the joint replacement is done. Some people don't. It's very simple. All they do is, they take the top portion of the knee and the bottom portion, they remove that knee, replace it with metal and other components, and I'll show you a picture of it. Tendon repairs, so if the muscle is completely torn, again, that's almost a necessary surgery. Patella realignment, people that have constantly dislocating patellas, another type of surgery, and some type of microfracture surgery to realign the knee itself. Sometimes it's necessary. Okay, so pre-op. So before the surgery, it's also important to do a few things. Almost the same thing to prevent injury. You do almost the same thing before surgery. So flexibility, key thing. Sometimes when people have an injury, that joint will tighten up. The muscles around that area will tighten up, preventing you from being flexible at that joint. So even before the surgery, because surgery in itself is a trauma, so you're going to end up getting more stiffness, more muscle tension in that area. So you want to make sure that you are as flexible as you possibly can be before surgery, because you will end up getting some stiffness later. So you want to add to the already decreased flexibility, so it'll make your recovery a lot quicker with increased joint flexibility. Strengthen the muscle. Again, surgery will decrease strength in those muscles, so make sure whoever's going for surgery, try to make sure that their muscles are in optimal condition before the surgery. The joints, or the muscles around the joint are as strong as they can be. Swelling, lowering the swelling, and walking with the appropriate devices, so whether it be a crutch or a cane to prevent any more irritation in that joint before surgery is also really important. And then home exercise program, which we here in physical therapy end up giving people before they leave. Total knee replacement. So basically, like I was saying before, what they end up doing, they're removing the top portion of the knee and the bottom. So the bottom tibia is actually shaved off, and the femur is shaved off also. Cap goes up on top, and just a small rod that goes down the tibia with a plateau right there. So it allows it to be nice to touch. Now what I'm hearing is that they're using a lot of metal, like cobalt, and then they're lining them with porcelain. And the porcelain, they've noticed, has a longer wear time than other materials, and just using the metal itself. So it extends the lifetime of that joint. The other thing, and this is something that I regress to preventing knee injuries, and even if you have a replacement, nutrition is important, exercise is also important, because also the less weight that you put onto your knees and throughout your body, the less wearing away you get of the joint. So weight is also an important factor. Not the only factor, but being at optimal weight is also going to help prevent wearing away of a replacement or wearing away of your own knees itself. Okay, so same thing after surgery. Sometimes doctors have a protocol. They don't want you to bend the knee to a certain degree, or they don't want you to move or pull weight through that leg. So following those protocols, but also making sure that the flexibility is there. So that's why we also help people making sure that they're able to start moving their leg, and that's key. Whether you come to therapy or not, the doctor will tell you you have to start moving that leg. You have to start bending it, making sure that it doesn't stiffen up, doesn't become and that'll prevent you from moving. The doctor may recommend physical therapy at a certain time, home exercise program, and also whether it's a cane, crutches, walker, some type of device that at least take some of the pressure off of your injury. Okay, so home exercise programs. A lot of times we'll send people with programs similar to this. Start with the least hard or the least stressful exercise, and it gets slowly more progressive that way. So quadricep strength sets is really just an exercise to start strengthening up the quadricep muscle. It's very, very easy to do. Laying down, and that's one of the first exercises we get people to do after surgery. Tightening up their knee joints, making sure that the knee is as flat as possible, and feel that muscle underneath your hand tighten up underneath it, and then relax. So it's basically just a hold and relax, hold and relax, and that'll just start waking up, quote unquote, the knee and the muscles around the knee, like the quadricep, because that's one of the most important muscles to hold up the knee, when you're walking. Straight leg raises, also another excellent exercise. Once you're able to do a quadricep set and hold it for at least 5 to 10 seconds, then we'll start getting people to do straight leg raises. So they're able to hold their knee nice and straight, lifting it up, holding it, and then bringing it back down. It's important not to really keep the knee out, especially after certain surgeries like an ACL repair or any type of ligament repair, because you may end up putting a lot of force on that knee. So keeping the knee locked without really bending it and doing those exercises to strengthen up those muscles is really important, or else you can cause more irritation, more problems at the knee. Quadriceps and hamstring stretching, very important. I always end up having people to do this because right after surgery, whether it's arthroscopy or ACL repair or total knee replacement, probably remember all those muscles, the quadriceps, the hamstring. Wasn't fun, but important to do. And these are just more exercises to work on the quads once you get to a certain level. And again, the ice right after and anti-inflammatories, whether the doctor prescribes you some type of anti-inflammatory. Yes.
Could you explain what ACL repair means and also short arm quads?
Yeah, sure. The ACL, what PJ was probably mentioning, or what she described, there are a few ligaments inside the knee. You have ligaments on the side, so one on the outside, one on the inside part of the knee. Then you have two internal ligaments. The PCL, which is the posterior cruciate ligament, that prevents the bottom part of the knee from going back, and the ACL, the anterior cruciate ligament, and it prevents the tibia, or the bottom part of the knee, from moving forward. So that when we're straightening our knee or we're bending our knee doesn't go too far back or too far forward. So when you're doing very strenuous activities or athletic activities, whether it's basketball, soccer, skiing, jumping, running, you need to make sure that that ligament is in place, or else your knee will just twist out of place and you'll end up falling and hurting yourself, breaking bones or whatnot. So that ligament provides stability. It holds the knee in place so that there's no dislocation of the knee itself. So the ACL, unfortunately, if you have a complete tear of it, so sometimes you can have, let's say this is the ligament, you can have sometimes a minor tear, so you'll have a couple of fibers tear off, and you have maybe one fiber still hanging on, so it's still attached. The body itself, because it's attached, can actually build up scar tissue around it and may repair that ACL. Now, if there's a complete separation of that ligament, when you tear it completely because of a brute force, there's a big gap between those two ligaments, these two pieces of the ACL. The body has no way of grabbing one end and grabbing the other end and pulling it close to each other so that it can start forming scar tissue around it and repairing itself. So when you have an ACL complete rupture or complete tear, the only way you can reattach it to hold the knee in place and stabilize the knee is going in there surgically and actually adding sometimes a tendon from another part of your body, whether it's the hamstring or the patella tendon. They have to put a piece in between it, stitch it together so that it holds that ligament in place.
And that's in front.
That's internally.
Oh, within.
So if this is the knee joint right here, like that, I really do wish I had a model now. It's between the middle part of the tibia and the middle part of the femur. And then you have the side ligaments here and here. So here and here you have two ligaments. Not as bad if you tear them because the body has a way of repairing itself. But the ones really internal, deep inside that knee, are the ones that kind of are very important for us. Yeah.
Besides assessment from physical therapist or MD, is there another test such as an MRI or CT that can actually diagnose that as well?
Yes, you can. But they're very expensive, especially MRIs.
Okay.
But yeah, I mean, they can come out. You can go for an MRI. You can go for MRI is probably the most accurate. The CT scan is better just at detecting fractures and bones because it's an X-ray. It's a 3D image of an X-ray with a CT scan, and an X-ray is just a basic, one-dimensional snapshot of your knee, and that probably won't ever show up on an X-ray.
And those would always get done before you had surgery.
Oh yeah.
Those would. Okay.
Yeah, I mean, they'll do that not only just to confirm that there is an ACL repair, but they'll want to know exactly, where, what position, what they have to do to prepare for that.
So soft tissue for MRI, for bone structure,
CT and X-ray. Yeah. There's some soft tissue structures they can't see in a CT scan, but more accurately than not is the MRI. Yeah, especially if they're going to do surgery, definitely. Okay. Any other questions? Yes.
Mentioned buckling of the knees. Can you explain buckling?
Buckling of the knee. Okay. When you get nervous or you're in love? Oh, the injury type is like Okay, so if you have an injury and your knees start to buckle, well, it means different things. It means, for one thing, that your quadricep muscle is very weak because of some type of dysfunction going on there. If the knee locks, sometimes people say, I've heard people say that my knee will buckle and it kind of locks and it stiffens up in there. Sometimes that's indicative of a meniscus tear or the cartilage inside the knee. So that sometimes it tears and there's a little piece of it sticking out. So when you go to bend or straighten your knee, it kind of gets caught right in the joint space and it prevents you from either bending or straightening, and then people will sometimes go down because of that. But a lot of times, more times than not, it's because there's instability because this muscle over here has lost strength, because maybe the patella losing or dislocating a little bit. Some people will get dislocating patella, or they'll have weakness in the quadriceps, so it won't be able to pull the patella up and down nicely, and you'll end up having that knee buckle. But it's mainly because of a strength issue. If it's not because of a locking mechanism like the meniscus, if it's just a buckling and you're going down, you feel that weakness, it's because the muscle, especially the quadricep muscle, is not strong enough. And I see this many times because, like I said, a lot of people end up using bad body mechanics over the course of their life. Their patella, their kneecap, will actually be tracking incorrectly. So patella tracking is a big problem. So one of the key things that I stress with people, especially in physical therapy, I always check out the muscle imbalances within their legs. So a lot of times people that have buckling of their knees, or if they hear a lot of clicking in their knees, I mean, that's a big thing. I always hear a lot of people, my knee always clicks. Why does my knee always click? That's primarily a muscle imbalance issue. That means that your quadricep muscle is very weak, or it's weaker than a lot of these side muscles over here. The majority of the case, that's what it is. Your iliotibial band and your TFL, or tensor fascial lata muscles, are the muscles that really can sometimes get very stiff, and they're very hard to stretch, so sometimes they become very tight. And the quadricep muscles, let me just, I'll get right to you. The quadricep muscles on the inner part of the knee don't have enough strength to counterbalance the pull of those muscles on the outside. So you'll end up getting your kneecap clicking off its track, and then as you straighten it, clicks back into place. So that a lot of times is a big problem, and people end up getting a lot of pain over here. And funny as it is, or interesting as it is, that problem in itself can not only cause knee pain, but it can also cause back pain. So that's I don't know how many times I've come across that problem. People come in with back pain, and then gradually figuring out and doing some muscle tests and flexibility testing, I'll start to notice that a lot of it is due to these muscles over here that are very tight because they attach at the pelvis. And eventually, talking to that patient, you'll hear, oh yeah, my knee on that side clicks a lot. I have a lot of pain on that side. A lot of it is due to that. It's due to those tight muscles, because if they tighten up, they'll start pulling in. This is exaggerated. They'll start pulling you to the right. So if this gets short and this muscle gets very tight, you'll end up walking like this, and putting all that pressure will shift all your pelvis over to that side, and you'll end up getting with this, pseudo back pain, which can be underdiagnosed and undiagnosed for many, many, many years. And, I've seen people just by working on their leg muscles, building up strength in their quadricep muscles. A lot of times the back pain eventually goes away also. So it's an interesting thing. That's how we're every muscle, every joint of our body is interrelated. So we have to make sure that we're in optimal condition, or else we can't have more problems later on.
There was another, you said that iliotibial band. What
Yes.
was the other one? The one on the other.
The tensor fasciolata. It's the Starbucks special. It's one of my favorite muscles. Yeah, also known as the TTFL, the acronym for it. Yeah, it's another muscle that a lot of people overlook, but it's super, super important when it comes to the knee.
So what do you do for that? What do you do with your
If it's tight, there's a lot of stretches that you can do for it. What I do a lot, and I recommend to a lot of people, I don't have it here, but one of the best ways to stretch is using a foam roller. I don't know if you've ever seen it, those long rolls. And a lot of times what you do is you get your leg right on top of it, and you roll over the foam to stretch out those muscles. So if this is a foam roll, this isn't it, but if I add it there, I would lay on top of it, and then roll my whole body over that foam roller, and it stretches out the entire muscle. Because it's very hard to stretch. The hamstrings, you can bring the leg up. The quadriceps, you can bend the knee. You can stretch the quadriceps. The iliotibial band, a lot of it is actually not muscle. A lot of it is just fascia and tendon. The muscles are further up here, so to stretch these out, to bring it all the way over to one side is very hard. So what I noticed, the best thing to do that is really applying pressure on top of it, and almost like a rolling pin, stretching it out, just like you would with Dell. That's basically it. It's very hard to do it otherwise, but it's the most effective and one of the most painful stretches that you can do. But it does help out a lot with many, many knee conditions.
It looks like something she might do in yoga.
Well, I wanted to add what you said about the rolling pin, because there used to be a dance there years ago, one of the things that we used to do was actually use a rolling pin on those muscles, because as you say, it is very hard for them to stretch them out. They get very tight and doing a lot of plies and things like that. And the rolling pin was you said it just came right back. Oh yes, we actually used a rolling pin. But there are other exercises you can do that help
To stretch that out.
stretch this out.
That's one of the best ways, yeah. And we use another device called the stick, and it's almost exactly like a ball. It hurts like crazy, but it's very good. It's very effective. Yeah. So I guess that's it for the knee.
Could you say
Yeah.
short arm quad?
Oh yeah, I'm sorry. That's right. Short arc quad is basically when you put a foam roller underneath your knee and you're laying flat and you're just doing kicks. So very small movement kicks. So a full arc quad, the arc is basically like a 30-degree arc. That's why they call it short arc. You're doing a 30-degree kick out. Long arc quad would be from 90 degrees, and you're kicking all the way out, and you're putting more stress on the knee joint doing that way. So you have to make sure. The only way I would start having someone do that if their quadricep muscles are strong enough to allow them to kick out that way after surgery. But typically it would be the quadricep quad sets, just tightening the knee, straight leg raises, and then eventually, once they're strong enough and they don't have pain while they're doing it, short arc quads, and then the more difficult long arc quads. Okay, so that's it. If you have any other questions, you can approach me. You can approach any of the therapists out there. We try to continue this educational series going. Today was the knee. I think next month. I don't want to give you false information like I did last month.
That was
They told me one thing, switched it to another, but I don't have too much control over that. But it will be another different body part. I think it's the shoulder, but don't quote me on that. But they're always informative, similar to the educational series we did today. Anatomy, almost everybody, scoot out of here.
Thank you.
All right, you're very welcome. Thanks for coming.
Very good. See you next month, no matter what it is.
We're going to have a short assessment. Where do we stay here? Or
You can come to the very front, just sign your name, and they'll have one of the therapists come out and do a quick assessment for you. Yeah. Yes, I'm sorry.
Yeah, I was wondering, you guys end up talking about glucosamine because I took a over-the-counter Walgreens product a year ago. It made me very ill. I don't know if it was something I
Was it-
allergic to.
Was it glucosamine or was it
It was
labeled glucosamine?
It was a combination. Glucosamine and brain and a bunch of other things. And I found out that I have an allergy to nightshades and that promotes arthritis. And that between the nightshades and maybe sensitivity to lactose and stuff.
Okay.
So some of it is dietary. So I've actually gotten a lot better with healing joint pain.
Just avoiding that.
Avoiding certain foods, but unfortunately, it's in a lot of vitamins too, because tomatoes are,
Yeah.
a source of lycopene. Supposedly, there's this stuff called alpha-lipoic acid. And
Okay. No,
that
I'm not
has,
familiar with that.
it's supposed to be a really good antioxidant, but it has potatoes and peppers in it. And I dumped it out, and it's hot, and I can't have any of that hot peppers or
I think some of that with some type of herbs too that they're able, or some type of root that they use to get glucose from. I know at Whole Foods I remember seeing something like that.
Yeah.
No animal products, no vegetable products in the food.
They should show you what's in things, because
Yeah,
they
they
just show
should.
you a chemical, and then
Yeah.
you take it because it's recommended, and it can actually make things worse.
Yeah, I know. Like I said, at Whole Foods, I went to this whole section on that, and you might be able to ask them. There's a product that any of that. I mean, glucosamine, enjoying my feeling about it. Some people say it helps, some people say it doesn't really help. It's like a 50-50 thing there.
Because I've read it helps as much or more than because I used to take a lot of what is it called? Ibuprofen.
Yeah, well, that's
It is, I know, well, that's Advil.
Yeah.
And that.
So I just press this screen to stop it?
I heard that on a radio
Move that
show
over.
that causes up to 10,000 deaths.
And then
Ibuprofen.
screen share.
Just because people,
Well,
people take too much.
Yeah, it's a blood thinner,
Yeah.
basically. So you can either eat away at the walls of your stomach, or you can
Yeah, click
like that. So I have people that thin